This is a video about Iota definitions. My name is Dr. Johnson and I'm a gynaecologist from Southampton. This is my list of definitions from the Iota literature. You need to understand the definitions before you can accurately describe ADNEXAL lesions and later use simple descriptors, simple rules and the risk of malignancy calculators. Any potential errors are mine. A woman is premenopausal when she is still menstruating, or if she's around the age of 50 with a Mirena coil. Be careful if patients aged more than 55 say that they're still menstruating, as this could be postmenopausal bleeding. Postmenopausal women are no longer menstruating or are aged more than 50 with a hysterectomy. An adnexal mass is a mass near the uterus not due to normal physiology. An adnexal lesion is that part of an ovary or adnexal mass that is not due to normal physiology. If there is more than one abnormality, for scoring purposes use the most complicated or the largest or the most easily accessible. Locularity, unilocular. This is a single locule even if it's not perfectly spherical and there is no solid material. For instance, a peritoneal pseudocyst which contains normal ovary is still unilocular, not unilocular solid. An ovary with a small cyst with some peripheral follicles is unilocular, not multilocular. Unilocular solid, a single locule which contains some measurable solid material more than 3 mm in height. Multilocular, more than one locule and no solid material. Multilocular solid, more than one locule, which also contains some measurable solid material more than 3 mm in height. Solid, if the lesion is all solid or at least 80% solid, with 20% cystic component. The dominant feature of the cyst contents is described as anechoic, low level, ground glass, hemorrhagic, or mixed. A septum is a thin strand of tissue running across the cyst cavity from one internal surface to the other side. Measure the thickest part of the thickest septum, preferably at right angles to the ultrasound beam. Note if there are irregularities or solid material arising from a septum. Solid component is a structure that has echogenicity suggestive of tissue, e.g. myometrium or ovarian stroma. This is judged by the echogenicity of the lesion, by the absence of internal movement when moving to the transducer, for instance clot wobbles and is not called solid material, and judged by the vascularity. A solid lesion can be vascular, but the structure that is not solid cannot be vascular, for instance clot. Some solid material is not vascular though. The white Rokitansky nodule in a dermoid does not count as solid material. Blood clot or mucin does not count as solid material. Solid area is tissue which measures more than 3 mm in height from the cyst wall. If there is a solid area, but which is less than 3 mm in diameter, it counts as a wall irregularity, but not as a solid area. The largest diameter of the solid area is the largest dimension of the solid area in any direction, i.e. not necessarily from the base upward, not just in height. If this measurement is less than 7 mm, then this counts as a benign feature for simple rules. Papillation is a solid area of more than 3 mm which arises from the cyst wall and protrudes into the cyst cavity. Or it's a solid area which arises next to a cystic component and indents the internal cystic structure. If the solid component in a mass does not indent the cystic structure, then it only counts as solid and not as a papillation as well. A papillation can be smooth or irregular. The papillation can be vascular or not vascular. But if it is vascular, this counts toward the LR2. If there are at least 4 papillations, vascular or avascular, this is a malignant feature in simple rules. Number of papillations can be difficult. and whether a papillation with an irregular surface counts as one or more papillations can be difficult. It depends on the depth of the cleft between almost discrete peaks. If in doubt, count them as 2 papillations. Irregular wall. This is if there are solid areas less than 3 millimeters, not large enough to be called a papillation and not large enough to be called solid material. Or if there are papillations, or if there's sludge from a hemorrhagic cyst, or if there's an irregular internal cyst wall in a dermoid. An irregular multilocular cyst means there is an irregularity in the internal wall less than 3 millimeters. If there are daughter locules arising from the internal cyst wall, this is not irregular, it is just multilocular. Irregular multilocular solid. If there is any irregularity of the cyst wall greater than 3 millimeters, now it counts as solid material, or if there is an irregularity within the solid material. Irregular solid mass. This means that the external contour of the mass is irregular, spiky or globular, and or the internal contour of any cystic area is irregular, e.g. spiky or angular rather than spherical. Internal variation in echogenicity does not make the mass irregular solid, e.g. fibroid. Evidence of metastases, this means a mental cake seen on transabdominal scanning, or peritoneal tumour implants seen on transvaginal ultrasound. Colour score Doppler. It's very important to use the correct settings, which are a PRF of 0.6 or even 0.3, which is more sensitive. This should generate a velocity of 3 to 6 centimeters per second with a balance of 220. Then you need to again adjust the Doppler gain to just below artifact levels. Colour Doppler is sufficient for most masses. If you're in doubt whether there is no vascularity, as this is a B feature in simple rules, you can use power Doppler as it's more sensitive to exclude any vascularity. Colour score Doppler 1, this means no flow. 2 is minimal flow. 3, moderate flow. 4, strong flow, either throughout the lesion or very strongly in one area. Vascularity at the edge of a lesion counts. Be careful it's part of the lesion and not part of the surrounding structures. The difference between moderate and strong, 3+ and 4+, is very subjective. If in doubt, ascribe the higher score. There is no rule for where in the lesion the vascularity is. E.g., in a pedunculated fibroid, it can be very peripheral. This does not matter. It really matters whether there is no vascularity, as this is a benign feature in simple rules, or whether there is strong vascularity, as this is a malignant feature in simple rules. If the vascularity is minor or moderate, then record this, but the vascularity score now does not count toward the risk calculations. Shadow is the loss of acoustic echo behind a sound-absorbing structure, e.g. dermoid, bone, cartilage, fibrothecoma and cystadenophybroma. The shadowing can be dense or very discrete. If the shadows are only seen transabdominally and not seen transvaginally, then it still counts as a benign feature in simple rules. Ascites is fluid outside the pelvis, that is, fluid that extends from the pouch of Douglas to above the uterine fundus. You measure the deepest pool, that is the depth in the anteroposterior plane. It's a vertical measurement. Simple descriptors, benign simple descriptors. A unilocular tumour with ground glass echogenicity in a premenopausal woman is an endometrioma. A unilocular tumour with mixed echogenicity and acoustic shadows in a premenopausal woman is a dermoid. A unilocular anechoic tumour with regular walls and maximum diameter of less than 10 centimeters is a simple cyst or cystadenoma. Remaining unilocular tumour with regular walls, again, look benign. A malignant simple descriptor, this would be a tumour with ascites and at least moderate colour Doppler flow in a postmenopausal woman. or a woman aged more than 50 years old with a CA125 level of greater than 100. Benign and malignant features for simple rules are the following. Benign features: a unilocular cyst, i.e. no solid material, a larger solid component of less than 7 mm, acoustic shadows, a smooth multilocular cyst of less than 10 cm, i.e. no solid material, or no blood flow. Malignant features are an irregular solid tumour, ascites, at least 4 papillary structures which don't need to be vascular, an irregular multilocular solid mass of more than 10 centimetres, or very strong blood flow. These are the features used in simple rules. And the simple rules are: if there are one or more malignant features and no benign features, the mass is classified as malignant. If there are one or more benign features and no malignant features, the mass is classified as benign. If there are both malignant features and benign features, or no benign and no malignant features, the result is inconclusive. So in simple rules, the classification would be benign, uncertain, or malignant. This is the report that I use in my clinic. I find this extremely useful as it contains all the features that I need in order to report my findings. Thank you.